Today I am going to start a series of success stories about all those patients who have come to me and taken treatment. It need not be only about IVF treatment, but I would actually be covering the fertility treatment that I am giving to my patients. So here today I'm going to talk about one success story. It is about how sometimes the right guidance helps the couple achieve their dream of parenthood. So hi, I'm Dr. Indu from Samrudh Fertility and Urology Center. So today I am going to share a story about a couple. Now let me tell about their background. So this is Mrs. X, who's around 31 years of age, and husband is around 36 years of age. Now when they come to me, actually what I see was that usually such couples, they are really anxious, but this particular woman was really very restless, and she was very talkative. She was venting out all her whatever frustration. She had been to some doctors. She had not found any specific specific outcome or outcome that she required or desired, right? So when they come to me, both of them come to me. So in general, when the couple comes as husband and wife, in the sense they're coming to me together, then that's always ideal, because both of them hear about their situation, where they stand. Now when they come to me, what I observed was that, looking at them, that both of them were not really having the great rapport, they are blaming each other for whatever is happening in their life. So one more thing that I noticed in them was that they were on the heavier side, and they both expressed that they were not quite happy with the doctors that they had met in the past, and they come to me with this concern. So when I see them, I talk to them. Generally it's all about taking the right history and going through their complete history that I would generally go with. So I note down all that. What I distinctly noticed was that both of them were on the heavier side. The wife and the husband, both of them very heavy, so high BMI. Though on understanding and evaluating, it was clear that she did not have any other significant fertility issue when it comes to husband or wife. But what was definitely kind of contributing was, number one was their weight, number two was that they were not very consistent in trying to achieve a pregnancy naturally. So now what happens is, in such a situation, they are given extensive counseling about weight reduction, significance of weight reduction, and at least concentrating on losing weight by up to 5 to 10% of their body weight enormously benefits their outcome towards any treatment that they go with fertility treatment. So this, when you talk about weight loss, it is not just talking in 2 minutes or 3 minutes. It generally takes a lot of time to convince, I would not say convince, to make them realize that what they are doing is not just for their pregnancy but the rest of their life, because health is wealth and they need to focus. And if they really take control of that now, this will really enormously help them through the phase of their pregnancy period as well. It is not just about getting pregnant, but it's also having a very smooth journey towards through the 9 months phase. So now when I talk to her about this, then she's really, she's getting what I'm saying, and she says, "Doctor, when you are giving me this scenario, I would definitely like to take action on this, and I would want to lose weight, because overall the cause of infertility was unexplained, as I said. But then do we say obesity is one of the reason? It could be a contributing factor." So she was very seriously convinced that she will take action, and she did take that action by going to a dietitian, and she enrolled for 1 year. Generally this is how my dietitian would do. And then she comes back to me. I told her, come every month and show the result that you are achieving. So she comes to me, and she actually is losing weight, and she gets really motivated, and then she is like, okay doctor, I want to take this journey of weight loss for another 2 months. So she does that for a total of 3 months, and she loses around 12 to 14 kilos, and she is really super happy. Now she said that, is it all okay, doctor? I want to really start the journey now. I'm feeling so happy, I'm feeling so confident that I will go ahead with the fertility treatment now. In the process, the bonus that she gets is that looking at wife, husband also is so impressed, and he also enrolls, or he also is becoming the part of weight loss. So even he loses around 10 kilos by diet and exercise. So this was something that they achieved, and when a couple are taking this instruction very seriously and they act upon it, I feel that I have not given them the treatment just for achieving their pregnancy, but then maybe they have tasted what healthy lifestyle is all about, and they realize that it is not very difficult. So then the fertility treatment begins, and what they required was only IUI kind of a treatment. So first cycle of IUI was conducted, but then that was not successful. But the couple were really not disheartened, because they were really having a very smooth, or I would say they were very happy to go ahead with the next step, and they were aware about its pregnancy rates, advantages and disadvantages. They said, okay doctor, we'll go ahead with one more treatment of IUI, and definitely as they are going through this journey, they were seriously taking all actions required to keep their weight under check, or rather reduce their weight also. So then what happens is that in the second attempt of IUI, this result comes positive, and the couple are really very happy. So I tell them that, okay, it is positive, let's wait for 3 months to cross, because that's when the pregnancy gets stable, and 90% and above, this pregnancy, when it is crossing 3 months, you have a very smooth journey and smooth outcome. So this woman took all the advices that was given to her, and she really had a very smooth pregnancy stage phase, and she did not have any other complications. She delivered a healthy baby at the end, and I think the baby is around 4 to 5 years now, and she's super happy. So what I want to tell here was that, see, the simple things, we don't take it seriously. You need to take this small suggestions, you have to act on it. If you act on it, definitely you are enhancing your chances significantly. So this is what happened in this woman and this couple, I would say. And I think when you see or hear such story, this definitely motivates you, isn't it? So I would like you to share this with someone whom you think that it might help them to take action when it comes to issues of weight and all. So this is all about today's story. So I'll again see you with another interesting story in the next case series. So thank you so much. Signing off, Dr. Indu.